Beta-1 selective blockers are a class of drugs that specifically block beta-1 adrenergic receptors. By blocking beta-1 signaling, these drugs reduce the work of the heart, making them useful for treating a variety of cardiovascular conditions. In this mnemonic video, we'll go over the mechanism, clinical use, and side effects you need to know to nail it on test day. Let's get started. We're here in the frigid north in the early 1900s, where the native community is returning from a hunting trip. This community has gone by many names over the years, including Inuit, Yupik, First Peoples, and, during colonial times, Eskimo. The term Eskimo sure sounds like the drug name Esmolol, doesn't it? Let this bundled-up Eskimo hunter anchor you to the first selective beta blocker in our scene, Esmolol. Up here in the north, frostbite is no joke. It's a good thing our guy has these big, fluffy mittens. Let these mittens remind you of our second selective beta blocker, metoprolol. You know, mittens for metoprolol? It's the metoprolol mittens. Our hunter seems to be trying to find his way in the frigid north as he's futzing with that antenna on that device he's got there. By the way, the antenna here should remind you of the drug name atenolol. Antenna and atenolol sound pretty similar, right? So that's an antenna for our third selective beta blocker in this scene, atenolol. A few other beta-1 selective blocker names you might encounter in this class are acebutolol, betaxolol, and bisoprolol. Generally, beta-1 selective blockers can be remembered as A-beam beta blockers, meaning beta blockers beginning with the letters A, B, E, and M tend to be beta-1 selective. My aim here isn't to help you remember every drug name, but rather the most common ones in this class, and those are atenolol, metoprolol, and esmolol. Got that? Now, look at this young hunter, just learning the ropes. He may not know how to hunt yet, but he's ahead of his time when it comes to sweets. Check out that lollipop in his mouth. This lollipop should remind you of the suffix lol, the common ending for all beta blockers. Keep in mind, the suffix is universal to all beta blockers, not just beta-1 specific ones that we cover in this scene. Not only is our kid hunter ahead of the curve for sugary snacks, he's also doing some hunting practice with his BB gun. A BB gun is Pixarize's recurring symbol for beta-1 receptors. Get it? It's the beta-1 BB gun. He might have really underdressed, though. Look how hard he's shivering. So cold, in fact, that he dropped his beta-1 BB gun. Let this falling BB gun remind you of antagonizing or blocking beta-1 receptors. So, altogether, this falling beta-1 BB gun represents beta-1 antagonism. So what does this mean for drug action? We cover beta-1 receptors in a dedicated video, so we won't go into too much detail here. In a nutshell, beta-1 receptors are mainly found in the heart, where their activation leads to increased heart rate and contractility. This makes sense since the beta-1 receptors are responsible for the increase in cardiac output needed for the fight-or-flight response. So, blocking these beta-1 receptors leads to decreased heart rate and decreased contractility. In cardiology jargon, this is decreased chronotropy and decreased inotropy. Altogether, this causes a reduction in cardiac output. So why might this be used clinically? For all sorts of indications, really. Beta-1 blockers are used for hypertension, since reducing cardiac output directly reduces blood pressure. Beta-1 blockade also reduces release of renin from juxtaglomerular cells in the kidney, which provides a synergistic antihypertensive effect. These drugs are also used for treating angina and myocardial infarction. You see, beta-1 blockers reduce cardiac output, and this helps to reduce the workload of the heart. Decreased workload means decreased oxygen demand, which is obviously good for treating cardiac ischemia. Next, these drugs can be used to treat arrhythmias. This makes sense since beta-1 blockade slows down the heart rate, which is crucial in treating tachyarrhythmias. For example, metoprolol is the first-line treatment for heart rate control in patients with atrial fibrillation. Beta-1 blockers can also be used to treat heart failure. Wait, what? Why would decreasing cardiac output help treat heart failure? Well, note that beta blockers are used for the chronic maintenance therapy of heart failure and not acute treatment of decompensated heart failure. The way I like to think of this is that decreasing workload on the heart over time can reduce cardiac remodeling, which reduces the risk of ischemia and arrhythmias that kill patients. In fact, taking beta blockers has even been shown to lead to a survival benefit in patients with heart failure, And most of this has to do with reducing workload of the heart over time. I want to note that we didn't symbolize these indications in this video because I don't think memorization as a symbol is how you should learn this laundry list. The way you should think about these is to remember that beta-1 blockers mainly target the heart to slow it down and reduce contractility, and everything else should follow. Got that? Let's move on. Before we close, let's touch on a few specific side effects of the beta-1 blockers. I want to note that we will not be covering a comprehensive list of side effects relevant to all beta blockers, such as hypotension and bradycardia, but rather the ones that are unique to the drugs in this video. Take a look at the mitten of our kid hunter there. Yep, it looks like it's been stained by the oil from a haul of oily blubber. This fatty pile should remind you of dyslipidemia, a relatively unique side effect of metoprolol. Basically, taking metoprolol can lead to increases in triglyceride levels as well as changes in serum cholesterol panels. Alright, that's all we've got for selective beta blockers. Let's recap. Selective beta-1 blockers are a class of drugs including esmolol, atenolol, and metoprolol. These drugs block signaling from beta-1 receptors, which works at the heart to reduce heart rate and contractility. The net result of this action is reduced cardiac output and reduced workload of the heart. Beta blockers are used for a variety of indications due to this mechanism, including treatment of hypertension, angina, or heart failure. A notable side effect of metoprolol is dyslipidemia, which is relatively unique on top of the general cardiovascular depression caused by beta-1 blockade. And we're finished with our selective beta-1 blockers. All of these mittens are reminding me I've got to get some warm clothes for this upcoming winter. I'll see you in the next one.